Welcome. Today we're diving deep into a specific type of kidney disease, cadmium nephropathy. This is a condition caused by long-term exposure to the heavy metal, cadmium. Understanding its causes, effects, and management is crucial for protecting vulnerable populations. Let's explore this complex disease. Cadmium nephropathy stems primarily from chronic exposure to cadmium. This exposure can occur through various pathways. Occupationally, workers in industries like metal plating, battery manufacturing, and mining face a higher risk. Environmental exposure is also a significant concern, particularly through contaminated food and water sources. Cadmium accumulates in the soil, entering the food chain and ultimately affecting human health. Smoking is another notable route of exposure, as tobacco plants readily absorb cadmium from the soil. The longer and more intense the exposure, the greater the risk of developing cadmium nephropathy. The pathophysiology of cadmium nephropathy involves a complex interplay of cellular damage and dysfunction within the kidneys. Once cadmium enters the body, it accumulates primarily in the proximal tubules of the nephron, the functional unit of the kidney. Cadmium binds to proteins, forming complexes that are taken up by tubular cells. Inside these cells, cadmium disrupts cellular processes, leading to oxidative stress, mitochondrial damage, and ultimately cell death. This damage impairs the kidney's ability to reabsorb essential substances, such as proteins, glucose, and phosphate, resulting in their excretion in the urine. Over time, chronic exposure leads to interstitial fibrosis, further compromising kidney function and potentially progressing to chronic kidney disease. While cadmium nephropathy can occur globally, its prevalence is higher in areas with significant industrial activity and environmental contamination. Populations living near mining sites, smelters, or areas with contaminated soil are particularly vulnerable. Specific regions with historically high cadmium levels in rice paddies, such as some areas in Japan, have also shown a higher incidence. Occupational exposure contributes significantly to the overall burden of the disease. Studies have shown varying prevalence rates depending on the geographical location and the specific industries prevalent in that area. Surveillance and monitoring programs are crucial for assessing the true scope of this health issue. The signs and symptoms of cadmium nephropathy can be subtle, especially in the early stages. Often, the initial presentation involves tubular dysfunction, leading to increased excretion of low molecular weight proteins in the urine, a condition known as proteinuria. Other early symptoms can include glucosuria of glucose in the urine, aminoaciduria amino acids in the urine, and phosphaturia phosphate in the urine. As the disease progresses, individuals may experience fatigue, bone pain due to phosphate loss and vitamin D dysfunction, and potentially symptoms associated with chronic kidney disease, such as swelling in the legs and ankles, nausea, and shortness of breath. Early detection is crucial because many of these symptoms are non-specific and may be attributed to other conditions. Diagnosing cadmium nephropathy requires a combination of clinical assessment, laboratory tests, and exposure history. Urine analysis is critical, focusing on the detection of low molecular weight proteins, such as beta-2 microglobulin. Blood tests can assess kidney function, including serum creatinine and blood urea nitrogen levels. Measuring cadmium levels in urine and blood can help confirm exposure, although these levels may not always correlate directly with the severity of kidney damage. A detailed occupational and environmental history is essential to identify potential sources of cadmium exposure. In some cases, a kidney biopsy may be performed to evaluate the extent of kidney damage and to rule out other causes of kidney disease. Cadmium nephropathy does not have distinct classifications or types in the same way as some other diseases. However, the severity of the disease can be staged according to the progression of kidney dysfunction, following the chronic kidney disease (CD) staging system. This system categorizes CKD based on estimated glomerular filtration rate (eGFR), which reflects the kidney's ability to filter waste products from the blood. The staging helps guide treatment and management strategies. Unfortunately, there is no specific cure for cadmium nephropathy. Treatment primarily focuses on managing the symptoms, slowing the progression of kidney disease, and preventing further cadmium exposure. This includes dietary modifications to manage electrolyte imbalances and bone disease, as well as medications to control blood pressure and reduce protein in the urine. Chelation therapy, which involves using medications to bind to cadmium and remove it from the body, has limited effectiveness and potential side effects, so it is not routinely recommended. In advanced cases of kidney failure, dialysis or kidney transplantation may be necessary. Prevention is the most effective strategy for mitigating cadmium nephropathy. This involves minimizing exposure to cadmium through various measures. Workplace safety regulations are crucial in industries with potential cadmium exposure, including proper ventilation, protective equipment, and regular monitoring of workers' cadmium levels. Environmental remediation efforts, such as cleaning up contaminated sites and controlling industrial emissions, can reduce exposure in affected communities. Public health campaigns can educate individuals about the risks of cadmium exposure through contaminated food and water. Smoking cessation is also a vital preventive measure. The prognosis for individuals with cadmium nephropathy varies, depending on the severity of kidney damage at the time of diagnosis and the effectiveness of management strategies. Early detection and intervention can help slow the progression of kidney disease and improve long-term outcomes. Research is ongoing to explore new diagnostic tools and therapeutic interventions for cadmium nephropathy. Recent studies have focused on understanding the specific molecular mechanisms involved in cadmium-induced kidney damage, with the goal of developing targeted therapies to protect the kidneys. Future research may also explore the potential of using biomarkers to identify individuals at high risk of developing cadmium nephropathy before significant kidney damage occurs.